Determinants of health are the guiding markers for what programs are needed in a community and are used when deciding what should be prioritized. Determinants of health are quite broad, so it is no surprise that utilizing them in program creation can be done in a broad way as well. These determinants of health can vary widely from person to person and community to community. So it is imperative that before assumptions are made about what type of program is best, a thorough analysis of the main determinants of health for the community and its inhabitants should be conducted. During this talk, I will go over what determinants of health are, how they impact chronic disease and life expectancy, systematic issues surrounding determinants of health, and the importance of community engagement and partnership with local and national organizations. Make sure to check out the Men's Health Network website to learn more about determinants of health, as well as how the organization is working with local communities to implement effective programs and strategies based on their needs and struggles. Determinants of health cover a large swath of topics and information. When examining them, it is important to keep in mind how different determinants may impact individuals in diverse ways, and that a single individual can have multiple determinants. Some of the more common determinants of health that are often considered are race, socioeconomic status, geographic location, employment status, behavioral factors, access to healthcare, and much more. These factors can cause an increased likelihood of developing a harmful disease, being restricted from accessing needed treatments, living in a supportive environment, and the ability to lead and understand what a healthy lifestyle consists of. These determinants are used as the building blocks for various health initiatives and can help to guide different health objectives for communities and companies. Men can have specific health determinants that are not as common among women, such as certain social stigmas, biological risk factors, and behavioral factors such as smoking and drinking. Understanding which determinants are most prevalent among the population is key to correcting its harms. Determinants of health can create environments that increase the risk of developing chronic diseases among the populations that it exists in. One example is socioeconomic status. Those who exist within a lower socioeconomic standing are placed at a higher risk of developing chronic diseases as they have less access to healthcare options, limited healthy food resources, and may live in a building that has harmful exposures. These determinants can surround individuals and quickly take a situation from basic and easily treated to complex and requiring extensive care. One disease that can suffer from this is mental health among men. Their mental health may suffer due to having work long hours because of the need to try and improve their socioeconomic standing or ability to afford to live within their community. It can also impact their mental health if they live in an area that does not have access to healthy foods. Diets that are heavily reliant on junk food have been shown to increase levels of anxiety, depression, and other related mood disorders. These factors can impact an individual in diverse ways and require more diverse solutions to account for all potential impacts. As briefly mentioned, systematic issues play a major role in increasing the prevalence of harms across communities. One such issue is lack of insurance. Lack of insurance can lead to a delayed seeking of medical treatment, allowing for issues to fester and spread to other areas of the body, or require more extensive and invasive treatment. Another systematic issue is that of transportation. Even if an individual has insurance or the ability to pay for medical treatment, they may not be able to get to where that treatment is. This issue is not limited to rural environments either. Both urban and rural environments have challenges with providing their population with a safe and reliable transportation network. To counteract this, it is important to ensure that bus routes, subway stations, and bike lanes are maintained, regularly upgraded, and kept safe for all individuals to use. For those in more rural areas, increasing access to ride shares, expanding bus routes, and making more pathways for recreational vehicles can also help to counteract some of the challenges faced by this population. As mentioned, ways of dealing with these challenges should be individually tailored to the different communities that the solutions are being implemented into. This will help to increase chances of success and acceptance. One way that has been shown to have increased benefits is to partner with local organizations and utilize their platform to launch and run those programs from. These setups see greater success as the local organizations already have an established relationship with the community, they understand the direct needs of the organization, and they have established means of communication within the community. When community members see an outside organization come into their neighborhood and attempt to implement new programs or change their way of life, they can be very standoffish. However, if it comes from an organization that they know and trust, they may be more receptive to what they have to say and will take greater care to listen. Organizations such as Men's Health Network can help these local community centers to implement productive and impactful programs that will lead to benefits not only in men, but for the community as a whole.